You ready, Lee? Good afternoon. Welcome to Taking It to the Streets, healthy conversations for us, by us, COVID-19 and beyond. Thank you so much for joining us. We have a special treat for you. My name is Athena McKay, the Executive Director of Flint Innovative Solutions. Be sure to like and share this podcast so that others can be informed about what's going on with COVID-19. And today's message is about mental health. We're here every second Sunday at 3:30 to 4:30. This production is brought to you by grant funding from the Community Foundation of Greater Flint. The Genesee County COVID-19 Portal, GCCP, is a hub of information surrounding COVID-19 for the Genesee County residents. We have specialized a mobile app to identify resources for our community. Today, as most days, we have our phenomenal health professionals, Dr. Latressa Gordon, Nurse T, Nurse Battle, and we have a special guest, Paul Spann, a law enforcement crisis intervention agent. Today, we'll share about CIT. Take a note, CIT. We'll learn about what that means in just a little bit. So let's open the floor like we always do with an intriguing question for our panelists to share with you. That question today is, what are some of the things you do to protect your mental health? Dr. Gordon, what are some of the things that you do to protect your mental health?
Good afternoon, everyone. Some of the things that I do, currently I just enrolled in the CRIM training, mindfulness. So I'm learning about being mindful, being in the moment, and also setting boundaries. That's the biggest thing I'm learning, is like, no, there's no other questions, or no is a complete sentence. So that's what I'm learning right now, is setting boundaries, being mindful in the situation, and just taking like self-care days, taking time for myself and doing things that I enjoy, because we give so much into everyone, mothers, grandmothers pouring into everyone. So now it's time that I'm just pouring into myself. So just mindfulness and self-care. That's what I do. Thank you. I'll popcorn it back to Athena.
Thank you, ma'am. That is so important. Let's try to check the audio. Tanya's out in the streets. So she was having a little bit of challenge on her audio. Tanya, you with us? Oh no. We'll be right back with you, Tanya. Let's popcorn her over to Nurse T. Nurse T. What are some things that you do, ma'am, to protect your mental health?
Hi, everybody. Some of the things that I do is I do a lot of meditation, and I love to write. And one thing that I have been intentional about in this season of my life is not people pleasing. I have a tendency to want to make sure that everybody is good. And so that's one of the things that I'm working strategically on, is not pleasing people and doing things that's healthy for myself. And also, I did join the CRIM training on mindfulness, also to reduce stress. So I think it's very important for people to have self-awareness and self-care, and to know some of the things that you have experienced in the past that may have caused you to have unhealthy friendships, unhealthy relationships, and unhealthy outcomes. So that's what I've been doing. And I'm gonna pop it back over to you.
Well, thank you, ma'am. I see that shine coming back too. That's important for those mental health. Appreciate you. So we're gonna bring in a crisis intervention specialist and agent, Mr. Spann. What do? You're out in the meat of these these craziness. What do you do personally to protect your mental health, sir?
So I think things that were already mentioned, wonderful things, um, setting boundaries, right? I think along with the concept of setting boundaries, for me, it's a situation of being able to disconnect. It's so easy in our line of work to, it's essentially take things home with you. So when your day ends, even on, by means of the clock, it doesn't end because now mentally you're taking all of these different things that you experience during the day, you're taking them home with you. And so I think the biggest thing for me is just having the self-awareness to be able to disconnect and really enjoy the time that I'm able to either spend with family or even also being, having the self-awareness to understand when maybe I just need to spend some time alone. So that's what I'm going to say.
Very, very, very interesting facts. For those that are out on the street, our frontline workers, these are some of the things that they do to protect their mental health. Some very wise words. I hope you're taking notes. I see Tanya back. Let's try her audio one more time. I want to be able to try to get her in. Nurse Battle. Oh, no. No, ma'am. Okay. Nurse Battle, if you want to put it in the chat, our chat, I can read what the answer at least to that one question, and then we'll figure out how to get your audio out, because I know you do some things to protect your mental health that we want to share with the audience. I am going to pass it over to Dr. Gordon to share with us what we all know is a crisis going on in our community. LaChester, you want to share?
Yes, when we talk about opiate use disorder, we know that the opiate crisis is almost like a pandemic all over the United States. And there's been an increase, in deaths and overdoses. So today we'll just be going to dive into a little bit of opiate use disorder. Next slide, please. The goal of this presentation is to equip you if we're going to define what opiates are, define what opiate use disorder is, discuss and explore opiate epidemic and how the stigma undermines opiate use disorder treatment, and empowerment and development of practical solutions. Next slide. Okay. What are opiates? Opiate is a term used for the entire family of opiate drugs, including natural, synthetic, and semi-synthetic. These drugs are chemically related and interact with opiate receptors or nerve cells in the body. And then we just have some common names of opiates like heroin, codeine, fentanyl. I won't go over them. Norco, Percocet, like Percs, lean. Those are some of the kind of street terms of different drugs. Morphine, fentanyl is a big one. Next slide, please. Opiate use disorder. What is opiate use disorder? In a nutshell, basically, it's a problematic pattern of opiate use that causes significant impairment or distress. Opiate use disorder is treatable. It's a chronic disease. So this is a disease process. So that's why we're talking about taking away the stigma, because this is just like any other disease. Like if you break your ankle, this is a disease process. To be diagnosed with it is based on a specific criteria, such as unsuccessful efforts to cut down or control the use, resulting in the failure to fulfill obligations of work, school, or home. And there's other criteria, but it can even lead to overdose and death. In 2020, it was an estimate about 2.7 million people ages 12 or older reported having opiate use disorder. Next slide, please. Addiction can happen to anyone. We want to make this, we are meeting each other where we are in the community. This is nobody's left behind. Like I was a soldier, veteran, and as always we were trained, no soldiers left behind. So now we're taking on no community person is left behind. So if you have any problems, you can go to the next slide. Any problems with this? And a lot of things is about the stigma related to it. It's like you don't want to know that you're suffering. This is a disease process. So we're taking away the shame, we're taking away the stigma. We want everyone to get the help that they need. Next slide, please. Okay, and this is just some statistics, like how it's a multi-layered problem in 3 distinct waves. Like in 1990, it was a rise in people being prescribed opiates. 2010, they started to realize there was a heroin overdose. And then 2013, that's when the synthetic rise of opioid overdose. Synthetic is like the fentanyl and different type of other opiates. And so more than 564,000 people have died. This is just from 1999 to 2020 per the CDC. Next slide, please. Promoting equity. Equity matters. So that means that, you know, everyone across the board, no matter what education, no matter what color, no matter whatever, we want to promote equity in treatment of opiate use. People are disproportionately affected by drug overdose crisis, including are not limited to those disadvantaged by reduced economic stability, experience disabilities, homelessness, mental health conditions, incarceration, limited, these are pretty much all like the social determinants of health, limited educational attainment, job, non-English speaking population, tribal populations, racial, ethnic minority groups, and sexual and gender minority groups. Next slide, please. This is just a framework of a strategic process. How are we going to fight opiate in our crisis in our community? So it just kind of goes over partnering broadly in community using evidence-based practice, advanced science, drive innovation, promoting health equity, raise public awareness. That's the biggest thing. We want to raise awareness. What is this? You know, how can you find treatment and point you into the right direction? Next slide, please. Okay, symptoms of opiate overdose: slow breathing, cold, clammy skin, extreme drowsiness, dizziness, weakness, lightheadedness, loss of consciousness, your blood pressure's low, into stomach problems, muscle twitching, weak pulse, blue lips, fingernails, and eventually not breathing or unconscious. Next slide. Okay, steps to respond to opiate overdose. If you're in the community, someone passes out, one of the biggest things is pinpoint pupils. But you know, you want to shout their name, shake their shoulders, call 911, give Narcan if available. We'll talk about that a little bit later. Perform rescue breaths, and but not right now. We're doing hands-only CPR. You can see that in the community. We're doing that later. If it's not working, stay with them and just keep repeating the steps, and then also put them in a recovery position on their side until 911 comes. Next slide, please. Okay, and this is just basic reference. I'll popcorn it back over to Athena. Just kind of a quick overview of what opiate use disorder is, the treatment for it. So I'll put it back to Athena.
Thank you so much. It's so challenging. I know there's a lot of people suffering from how this impacts our family. And I think that's why it's so important to have Mr. Spann in talking about how we connect with opioids, will connect with our mental health and prevention. I do want to, Dr. Gordon, I want to tell the audience too, if you have any questions or comments, please add those into the chat so that Dr. Gordon and our other experts can address those questions. If you could stop. Okay, there we go. Thank you, Alita. So I'm adamant. I want to get Nurse Battle in here. I'm going to try her audio again. She did drop in her chat. Nurse Battle, you with us?
Can you hear me?
Yes.
All right.
Well, there is a way. I'm like, hold on.
Amen.
So you put it in the chat, but please tell our listeners what you do to protect your mental health.
I agree with Doc G and Nurse T, and that is to be mindful and set boundaries. And I put in there to just, if you say no, it's unapologetically, and that is to protect your space and your mental health. So, I'm learning to say no and not to overextend myself, and to just be mindful. Like Nurse T said, meditate and just try to, mindfulness and just meditation and being in the moment, and, just not overextend yourself, and, That's it.
See, it
Just
was
saying
very
no. Learning how to say no.
That's so important. So, Tanya, now that we got you live and in person, did you have some COVID-19 updates that you would like to share with us?
Absolutely, yes, yes. I'd love
Awesome.
to share about these COVID-19. We are still doing clinics. We have our COVID updates. We have a 7.9% positivity rate, as well as 2.2 percent hospitalizations right now, and it is rated low right now. However, we still need to be mindful that it's still here. So next slide, please. And then, so our upcoming clinics are our usual standing clinics for this month. Well, where are we? This week now. We'll have Central Church of the Nazarene on Wednesday from 10 to 12 p.m. And then on Thursday, Michigan United will host a clinic at New Creation Church on, well, the address is 3472 Lennon Road from, I believe, 9 to 12. And then well, this is not a clinic, but I just do want to put it out there. Our the Healthy Flint Research Coordinating Center, HFRCC, on every Friday from 12 to noon. And, I just want to encourage everybody to tune in to the HFRCC weekly webinar because they have great updates and they have great information for our community. And then on next week, our standing Genesee County Health Department clinics will be on Tuesday, February 21st at Our Lady of Guadalupe from 12 to 2, and at Shiloh Missionary Baptist Church on Thursday, February 23rd from 3 to 5. On next Thursday, we have a lot going on February 23rd. We also have Michigan United hosting a vaccine clinic with just COVID vaccines at the South Flint Soup Kitchen. And that is located on at 3410 Fenton Road from 10 to 12, as well as our self-care wind down. This is with Nurse T. And so this is our first self-care wind down that's going to be at the Greater Flint Arts Council on Thursday, February 23rd, and it's going to be from 5:30 to 7:30, and we're excited about it. So please, please mark your calendars, and I believe we'll be doing this, Nurse T will be doing this every fourth Thursday of the month at the Greater Flint Arts Council from 5:30 to 7:30. So please mark your calendars and plan to attend. And also one last clinic at Agape on February 25th. Michigan United will be hosting a clinic from 12 to 2. Next slide, please. So if you are homebound, we do have access to we do home visits. You just have to give us a call and we will come to you to do your home visits. Next slide, please. And also testing. Testing is still very important. Walgreens is still doing testing, as well as Hamilton and Rite Aid is doing, I think they do walk-ins. Next slide, please. As well as other testing sites are Word of Life Church on Tuesdays and Thursdays from 12 to 6, as well as Bethel United Methodist Church Tuesdays, Wednesdays, and Thursdays, and Macedonia Baptist Church on Monday, Friday, and Saturday. Testing is still very important. So please, take note of our testing sites. They're still available. Next slide, please. And again, if you know someone who is unable to make it out to a clinic but is interested in getting the vaccine or needs any information on COVID or vaccination information, they can call 810-344-4800 for information, or to schedule a home visit, to schedule an appointment time to get your vaccine. We will come to you again. So next slide, please. Okay, thank you.
Thank you, Nurse Battle. Quick question. What are the age range? Are all of those clinics available for all ages?
Well, all clinics are not available for all ages. So if you have little babies, we um, do vaccines for 6 months and up, 6 months to 5 years and up. So you just need to make sure that the clinic that you're looking at, or meets your needs. So like Michigan United, our clinics are for 12 and up.
Okay.
So just make sure that, if you have little people that you're looking to get vaccinated, to make sure that the clinic accommodates the younger people.
Gotcha. Thank you, ma'am. Again,
Thank
if you have any
you.
questions or comments about COVID-19, also opioids, please add them in the chat for our experts to respond to. We are going to toss it over to Nurse T, who's going to share some heart awareness information with you. Nurse T, you there? Oh, we will come back to Nurse T. So I'll fast track it to our special interest today is mental health. As you know, COVID-19 has played a tremendous toll on us as a community, individually, and our families. And so your heart is impacted. I do see Nurse T, so I want to bring her back in if possible. Y'all see, we going through some technology changes today, but we out in the streets and we trying to get the news to you. Nurse T.
Yes, can you hear me?
Yes, hear you loud and clear. And here are your slides, ma'am.
Okay. So good afternoon, everybody. We have had, and we are going to continue to have some wonderful conversation about a lot of things that impact us. I know Dr. G talked about the opioid use disorder. Tanya gave us some updates on COVID, and then the police officer is going to come on and talk about the CIT. But the one thing that we must know is that everything is centralized around our heart. The most vital organ in our body is our heart. If we don't take care of ourselves, and if we don't take care of our hearts, and then our heart will stop pumping blood, and we will not be able to continue the great and wonderful things that God has called us all to do. So what I want to briefly touch on is guard your heart and talk about heart health awareness. February is designated for heart health awareness. Every day of our life should be focused on heart health awareness, but because this is a designated month for it, I just want to give shouts out and education on heart health awareness. Next slide, please. So while I'm not going to read all of the information on the slides, I just want to pull out some important points. Heart disease is the leading killer for all Americans. However, African Americans and Hispanics face even greater risks. The prevalence of high blood pressure in African Americans is the highest in the world. According to the U.S. Department of Health and Human Services, African Americans are 30% more likely to die from heart disease than non-Hispanic whites. Some studies show, and I looked up these, different people's opinions, and research was saying that African Americans may carry a gene that make them more salt sensitive, increasing the risk of high blood pressure and heart disease. So that could explain why we like a lot of salt and why we cook a lot of salt. A lot of times people talk about our histories and our palates, but that's just one thing that we need to consider. Next slide, please. The definition of heart disease. Heart disease refers to several types of heart condition: hypertension, congestive heart failure, coronary artery disease. You can have a heart attack and myocarditis. Next slide. Risk factors for heart disease: overweight or obese, smoking, diets high in salt, 2+ alcohol drinks per day. I know that we are social, and we just need to make sure sometimes that we keep our drinks to a minimum if possible. And stress. Stress is probably the number one. Stress is the number one thing that causes Americans all over to have medical chronic conditions, and it agitates, it escalates everything in our body, especially high blood pressure, and even if you have diabetes. And then too, as far as physical activity, a lot of times we don't exercise and meet the 30 minutes a day, or at least 3 to 4 5 times a week, as this as much as you can do. But these are the risk factors for heart disease, which a lot of us have those risk factors, myself included. I am overweight or obese, even though I always say that I'm fine, fine. And, and I look snatched all the time I go places. But because my BMI is greater than 25, I'm at risk. Next slide, please. And another thing we need to consider is our family history. Do our family have a history of heart disease, history of sleep apnea, history of chronic kidney disease, history of thyroid disorders, history of adrenal disorders? Next slide. Signs and symptoms of a heart attack. This is where I really want you to focus in on. If you have chest pain or discomfort, upper back, upper body or neck pain, indigestion, heartburn, nausea or vomiting, extreme fatigue or dizziness. These are some of the signs and symptoms of a heart attack, but you might not display all of these signs, especially if you are a diabetic. You may be numb to some of these feelings. You may get short of breath, diaphoretic. You just might not feel well. But the one thing, if you start feeling different, or you start feeling that is not your normal self, please make sure that you follow up. Please make sure, if you become severe shortness of breath, that you go to the emergency room. Having a heart attack is a medical emergency. I know we like to pray, but as Dr. G said, we can pray, but we don't delay. Next slide, please. Signs and symptoms of heart failure is shortness of breath, extreme fatigue, swelling of feet, ankle, legs, abdomen, or neck veins. Now, one common identifier for heart failure: if you like to sit up in a chair at nighttime and you tend to prefer to sit up in a chair versus going to bed, and if you breathe better sitting up in the chair, that is one of the most simplest forms that you may be having some signs and symptoms of heart failure. If you start gaining, weight unexplainably, every day you step on the scale and you like 2 to 3, or your legs is just extremely swell, please make sure you pay attention to these signs and symptoms. Next slide. Self-care tips: don't smoke or use tobacco. And if you do, please make sure that you get some assistance. They have a lot of education on tobacco cessation, physical activity, at least 30, 60 minutes a day, heart healthy diet, maintain a healthy weight, manage your stress. And the one thing, regular health screenings. It's very important that you have a primary care physician, or you go to an urgent care or you go to some type of outpatient clinic like Hamilton, so that you can have some service or a physician looking at you. And number one thing too is keep your blood pressure under control. If you happen to have hypertension, please make sure that you are following the doctor's orders for your medications. And if there's any changes or anything that's not working, that you let your physician know. A lot of times what we do is we self-medicate, we self-diagnose, and we self-take care of ourselves. And that takes us out of the plan that the physician has for us. So please make sure you are being compliant with that. Next slide. And activate your healthcare power. 90% of heart disease is preventable through a healthier diet, regular exercise, and not smoking. So that should be kudos, and that should cause you to just shout. A lot of the medical conditions that we are experiencing, they are preventative. Try to limit saturated fats, foods high in sodium, put down the salt shakers. And if you just have to cook with salt, try to do it sparingly, or when you sit down to eat, try not to add any additional salt. And the one thing that everybody talks about is stress. Reduce stress as much as possible. Next slide.
Thank you so much, Nurse T. That was a lot of information. I hope y'all took notes. We're going to bring Nurse T back for any questions that you may have. Again, if you have questions or comments about your health, your heart, please add them in the chat. You can see we have some knowledgeable healthcare professionals here. Thank you so much, Nurse T. As we said, we know that COVID-19 has made a huge impact. We've been in the house munching a little bit more. I know the cost of eggs has made us munch a little bit less, but it is important for us to take care of ourselves, mind, body, soul, and spirit. As Nurse T said, you need to be mindful of the things that you're eating. Be mindful, period, to track your mental health. As Nurse Battle mentioned, it's so important to be preventive with COVID-19. And then what Dr. Gordon said, make sure that you're not leaning on some unhealthy habits to get us through these hard times. We have a special guest today, Mr. Paul Spann, who will be talking about CIT. We do have a quick video to show for some of you who may not know what CIT is.
Law enforcement officers are dedicated. Every day they put on a uniform and deal with everything from pesky kids on skateboards to bank heists. And while officers always strive to do their best, sometimes they encounter situations more suited for social workers, like dealing with mental health crisis calls, which is why we have crisis intervention teams. CIT programs teach law enforcement officers how to safely de-escalate mental health crisis situations. In fact, law enforcement agencies that have CIT programs in place have reported as much as an 80% decrease in officer injuries during mental health crisis situations. Not only do CIT programs educate officers, they also bring together community members and mental health care providers to offer convenient options for treatment and to reduce the number of repeated calls for police service, saving officers valuable time. Take the next step in helping your community better respond to mental health crisis calls. Learn more about CIT programs by visiting NAMI.org/CIT.
One of the things that I love about this system that we have going is that the information repeats. So we had a mental health specialist on before who mentioned NAMI. Now we have another professional on, Mr. Paul Spann. Before you even actually start, who are you? What school you repping? How long you been in Flint? Say hi to the people.
Hello, everyone. So I am Paul Spann. What school am I repping? So Flint Northwestern, right? And then by way of Michigan State University. And so here I am. I'm back in the Genesee County. So
Hold on right there. This is what we normally do. When we say Indub, y'all, how we feel about Indub up in the place?
This is what I did.
Come on, don't act like that. Don't act like that.
Hey, we all family.
Welcome anyway.
Thank you.
We gotta keep love and light. I'm a wildcat, so you got my support up in here.
Exactly. See, so I knew I'd have at least one.
Absolutely.
I appreciate that.
Mr. Spann, let's dive right in. We have your slides for you. Tell us what the CIT is. What does it mean for our community? And if you have time, how did you even get involved in this area?
Okay. Yeah. So quite basic CIT, crisis intervention team. Okay. And so this is just going to kind of be a slideshow that's going to transition you into to give you a little bit of a background. It's the type of topic literally we could take a full show to really unpack and dissect everything. But today I'm here to kind of give you all an overview and answer some of the questions that you may have. So again, CIT, crisis intervention training or team. You can go to the next slide. All right, so this next slide is just kind of us patting ourselves on the back a little bit. So this talks about the inaugural group in Genesee County of law enforcement that went through CIT training. It was a really, really big deal. And so that's what this article just basically highlights that. And I was a part of the initial group that went through the training. Next slide. So right here, it just talks about the crisis intervention team and Michigan, right? So these are some of the other counties that were kind of already on board: Calhoun County, Muskegon County, Detroit Wayne, Oakland County, Tri-County area, which encompasses Eden, Ingham, and Clinton. And now Genesee County is also a part of that group. Next slide. So what is CIT? Okay, CIT is a program that has two basic goals. Goal number one is to improve officer and consumer safety. Goal number two is to help persons with mental disorders and or addiction, helping them get access to medical treatment, kind of as a diversion from placing them, into the criminal justice system, which was due to illness related behavior. So, kind of unpacking that means not necessarily that you get a pass because you suffer from a mental illness to just kind of run amok and do whatever you want. But it's just saying that sometimes when we go into these situations, it's not always black and white. There may be some underlying things that we have some other resources and avenues that we can go that are going to be a lot more beneficial to this individual as well as society. Next slide, please. Benefits. All right, so CIT, it reduces the arrest of people with mental illness, all right, while simultaneously increasing the likelihood that these individuals will receive mental health services. So just real briefly, when you talk about that, not always when law enforcement agents respond to a situation, it doesn't always result in that person necessarily getting the type of services or help that they need. Prior to the CIT, it was more of a situation of law enforcement just hadn't been trained in that, right? So we didn't understand that, okay, there are some other underlying things that are going on here. We didn't have those resources, so it was kind of like our avenues were a little bit limited in terms of the actions that we could take. Now with the addition of this type of training, this gives us like what we like to call kind of like another tool in our tool belt. So when we come into these situations, we can unpack them. We can look at some things, and sometimes it still does. The end result is that person does end up being arrested, but not always. Second point, it gives police officers more tools, which I kind of just pretty much talked about, to be able to do our job safely and effectively. Research does show that the CIT is associated with improved officer attitude and knowledge about mental illness. Next point, or you can go to the next slide. Thank you. All right. So the CIT training for law enforcement, you're talking about a 40-hour training. So this is not just we walk into a room and for an hour they show us a bunch of slides and we hear some testimonials and then it's like, hey guys, get out on the street. This is a comprehensive 40-hour training. Some of the topics covered: mental health, substance abuse, which was something that was discussed a little bit earlier in the podcast, domestic violence, civil commitment, specialty courts, legal issues. So just briefly, and I won't go real far into this. So when you talk about specialty courts, a lot of people are not aware that there is a court specifically that will deal with individuals who, whatever it was that they did, whatever crime they may have committed, that crime was found to be a manifestation of their mental illness. we actually do have a mental health court. We also, as well, we have courts for veterans, right? So there's also a drug court. So again, other avenues, other resources that we have, and again, just kind of going back to that concept of another tool in our tool belt. The AOT program is an outpatient treatment program. So again, when we come into these situations, right, it may be a type of situation where we need to be able to get this person to commit to some type of a program where they are monitored. We're making sure that their medications are being taken, and again, you're able to track the success of that individual. Cultural considerations and implicit bias, because again, as we all know, these are things that come into play in law enforcement, and not just dealing with mental illness. This is part of that training. Resource fairs, autism, dealing with youth in crisis versus adults, Alzheimer's, dementia, verbal de-escalation, trauma-enforced policing. We were able to be to be able to talk to a panel that came from the National Alliance on Mental Illness of folks who have had people who have been a part of this interaction with law enforcement, and just kind of hear some of their experiences, both good and bad. Officer wellness, suicide by cop, things like that, veterans needs, things I addressed before. Next slide, please. So what else do we do, right? What else happens with CIT other than us responding to these mental health related calls? So mental health response, right? So now you're seeing that you don't have to wait until you have actually passed all of your tests and now you're out here on the street to get this training. You're actually seeing this mental health training is being applied in the actual police academies. Stress management, right? Another thing that we work on. There are Ignite classes. That's a program in Genesee County that does work with individuals who are incarcerated and who have been incarcerated to help them be on track and get on track to get out and be productive members of society, right? Kind of fighting some of the stigmas and stereotypes that get associated with that population. Developing co-response programs, mental health support for law enforcement officers and other responders. Okay, because a big piece of this is that as a law enforcement agent, as a first responder, we're constantly experiencing all this trauma day to day. So we have to be able to be self-aware to also have a check of ourselves before we can be able to go out into the community and help serve and protect. And then finally, planning for working with dispatch training. And essentially what that talks about is, in the past, calls would come in and they're kind of all coded under different categories. We didn't have a specific category for mental health. Mental health calls kind of got grouped into a number of other categories. So now we are working with dispatch and with training to be able to come up with a category to identify those calls that are mental health related calls. Next slide. Finally, Genesee Health Systems, right? Awesome resource in our area. This slide talks about specifically in the Flint area, there is a behavioral health urgent care. It's located at 422 West 4th Avenue. This is a great resource because this is an alternative to an individual in crisis going to the hospital. A lot of times when you talk to this population, again, some of the things they complain about are wait times when they go into the hospital. Our system, the health system, right? They're just so overworked. A lot of times there aren't the resources to be able to adequately serve all of these individuals. This gives them another resource, even if they're feeling actively suicidal, they've been off their meds, different other situations that are going on. This gives them another resource. And the other cool thing about this is they also have video chat services, which are 7 days a week, 24 hours a day. Thank you.
This is tremendous. Thank you so much for joining us, Mr. Spann. What was your biggest takeaway from the training?
So I'm going to say the biggest takeaway for me was I think I benefited most from being able to just experience the panel that came in of individuals who had these interactions with law enforcement, and just kind of listen to them talk about the difference in having a person respond that kind of took the time again to unpack the situation and to realize that there may be some other pieces to this. And like I said before, you know, doesn't mean necessarily that at the end of the day that individual wasn't arrested. But again, it's all in how you talk and just the way you treat people. And I think just being able to hear that account, right, of folks who had that interaction with law enforcement that have been CIT trained versus law enforcement that hadn't, for me, that really stuck. Definitely.
Awesome. And you shared a video. Did you want to preference that video before I show it for you?
Yes. So the video that you have here, there's actually there's a team of guys, and they're actually part of a bigger team now, but they were kind of like the guys at the forefront, Ernie and Joe. And it's called Ernie and Joe Crisis Intervention Cops. And this actually is a special for those of you who do have access to HBO Max. You can go and check it out. It's actually currently running. But it kind of just really quick, it gives you an idea of, in an ideal situation, what you see when you have officers who are trained in crisis intervention respond to a call. Keep in mind, too, you'll see in some of the footage, they're kind of dressed plain clothes. Doesn't always operate like that. But again, it gives you an idea of kind of in an ideal situation environment, this is what the interaction is going to look like.
I'm going to head over to Code 1. EMS is going to be out with them. I'm being told that she is going to be on that bridge. Where's she at? She's sitting on the rail here.
No one calls us to give us good news. They call us because something bad is happening, and so they're in a crisis.
Are you okay?
We used to have a saying in law enforcement, ask, tell, make. I'm going to ask you to do it, I'm going to tell you to do it, and I'm going to make you do it.
On average, in a police academy in this country, they spend 60 hours or more learning how to shoot a gun, and they spend 8 on mental health and communication. We need to shift that.
He is now feeling suicidal and homicidal.
Your mom said that you haven't been on medication?
They found Mel who was trying to commit suicide.
Are you hearing voices right now? Yes. What are they saying to you?
Has anyone here, while you're in a work capacity, told someone, I'm scared?
As human beings, we have to be connected. I unplug a lamp, it don't work.
Are you okay?
I promise you I can help you. You might be broken, but you're fixable.
If it takes me all day long to convince them that we're not going to hurt them and they're going to come with us.
How you doing? You okay?
I'll take all day long.
Oh, no. This is my partner, Joe. My name's Ernie.
Woo! This is not for the faint of heart. All of you, I'm going to bring the whole panel back in. What you do, literally, the name of the podcast is Taking It to the Streets. And you are out on the front lines. Officers of the law who partake in this are nurses that are also taking blood pressures, doing all kinds of, and administering the COVID-19 vaccines and other things. I just want to open it up to you first to say thank you. It takes that human element to say, okay, I care about what other people are going through. I'm going to get the proper training to help my community advance, teach them about how to eat properly to protect their health, teach them and educate them about the benefits of the virus, the benefits of the vaccines to prevent the virus as another layer of protection. And Mr. Spann, also in the middle of a crisis, having those words of wisdom and having that heart element to reach somebody in their darkest place and bring them back to light. Just kudos. I just want to stop and say kudos to all 4 of you.
The one thing that stood out to me on the video was that the officer said, you are broken, but you're fixable. And so that gives hope.
Yes, absolutely.
I agree. I like, like in as like I worked like ER trauma nursing, so it's fast paced. So you had to discern what's going on. Same thing as out there. I'm not a police officer, but I know you have to, when you go in a situation, you have to be fast thinking, discern the situation, and you only have a split second to determine like, oh, we got this call. What is this? Like, we also train people about blood sugar. Like if you see somebody driving, they may look like they're drunk, but actually they can have their low. So identifying other causes. What is the root cause of this person? I like all the different reports. Like I'm a veteran. So I've heard I don't want to go there, but I heard the veteran court giving people that chance with, decriminalizing mental health and the stigma with this. So this is just awesome. And I, commend you for that CTI training.
Amen. Yes. That's
awesome. We need more of this training, because you say going away from the old thing. Like if you see someone like giving a command, like stop. Okay, why are they not stopping? We do know some people are not stopping because they have malicious intent, but then we know some people it's because of their mental health issue. Because I know I ain't gonna lie, I'm claustrophobic. If you say get in this car, put these cuffs on, I'm gonna act fool on you. You know what I'm saying? So, but it's not because it's because of claustrophobic. And we heard even George Floyd, when he was being just being handcuffed, he said that he was claustrophobic. So just recognizing those symptoms and taking that call. So high pressure, environment, split second, because 1 second can mean life or death. So I just commend you for taking that training and bringing awareness to it. Awesome.
That's awesome work. Yes.
Can you guys hear me?
Yes.
So I am on the board of NAMI. So I often go and speak on behalf of NAMI for that training as well. And one thing that I like to share with the officers is considering when they do be there and they having experiences with the patients in the community or residents in the community, and why it's so important for them to be aware of the mental health issues and concerns, and being able to identify a mental health crisis versus a traumatic experience, and also the importance of listening to the parents and those that are nearby, because the ones that are advocates, they can honestly say, hey, my loved one has a mental health crisis, please handle them with care. So very impressed and pleased to be able to be a part of NAMI and to have the reception or the receptiveness from the police officer and the interest to be able to better serve our community. Because a lot of times what happens is they go to jail and then they don't get the help that they need in the past.
Absolutely.
Oh, sorry.
No, go ahead.
I was just real quick. And that was one of the things I was going to talk about too, is that we ultimately taking the time to make sure that these individuals get the appropriate health care that's actually going to save money in the long run, because it's going to be a lot cheaper to get them to the mental health services that they need versus spending the money that it's going to cost to keep them incarcerated. And during that time, they're not getting the help that they need. They're not getting any better. A lot of these individuals, unfortunately, once they're released, we're interacting with them again, and it becomes this cycle, right? Until someone gets to the root of evaluating what is it that's causing this. And so once you're able to do that, you get them the mental health care. Now we're able to get that individual where they're gonna be able to see some progress. And one of the things that it talks about too is then for law enforcement agents, officers, or what have you, now we can spend time addressing some of these other issues that are going on in the society and like that. The purpose of this program is not to try to make us social workers. It's not to try to make us therapists, counselors, but the reality of the situation is that on any given call that I go on, I may have to wear all of those hats. Right? I may have to be a teacher. I may have to be a father to someone. So why not have the training, right? So that, again, it's one more tool in your tool belt, so to speak, one more resource so that we can efficiently protect and serve the community.
Yeah, absolutely.
That's so awesome.
Thank you so much.
Dr. The vending machine. Okay. So Friday, they unveiled a new vending machine at the MTA in Genesee County. It is a Narcan vending machine and fentanyl testing strip. It is free of cost. You can go in there and get the Narcan. This is if you keep this on you. If you know someone that uses opiates or you're around this, someone, so it's free, and this is a life-saving intervention. So there's no prescription needed. No ID needed. Just go in there. I'm not quite sure I haven't used it, but it's self-explanatory. When you get there, it is free. Because fentanyl has been laced in other type of, drugs, and it is deadly. I mean, a small amount. It's not like what you get when you come in and have surgery. Takes a small amount of this, and it can stop you from breathing, and it can kill you. So being aware of what you're taking. So this is another way of destigmatizing opiate crisis, and Officer Paul can talk about that, like when they bring people in. So a lot of people with mental health too are afraid. You already hear like, don't call the police, because if the police come, they're gonna, that training is big, because people, like, if you call the police, because we've known, instances of all, even in medical, where it's been mishandled before, and the person was actually having a mental crisis, and it didn't turn out well. So that makes people afraid. So by you stepping up and you taking this training, is building that bridge in that gap between the community and the police officer. We are here to protect and serve and not do harm. So that's the biggest thing that we have to, in the brown and black community, is to promote that. And I just thank you so much again for your work and everyone.
Thank you.
Thank you, thank you, thank you. We have our announcements that we'll share. Hopefully we'll have a couple of seconds to come back into this conversation. MISHIRE, the Michigan Institute of Clinical Health and Research, the community-based organization partners, or CBOP, and Black Lives Matter will have a town hall next Thursday, February 23rd from 11:30 to 1 p.m. They will disseminate the research findings from the Research Readiness and Partnership Protocol at Hasselbrink Senior Center over there with Miss Beverly. Lunch will be provided and bottled water will be distributed. Their registration is required, and we'll put that link in the chat. Next slide, please. As you've heard us say multiple times, GCCP is a technology hub to share all the resources from Genesee County and COVID-19 to our residents here. It's funded by Community Foundation of Greater Flint. Next slide. They can be found at flintinnovativesolutions.org/GCCP. You can also download it to your phone. Next slide, please. We also have the Flint Eats app. Again, GCCP. I'm sorry, if you can go back since you put it up there. It locates the testing sites. Tanya always does a phenomenal job sharing that information with you, but we may not have time to write everything down. If you use the mobile app, it will have that listed. Again, the testing site, vaccine sites, also data, that graphic that we had as far as our positivity rates, all of that can be found at GCCP. Next slide. We also have the Flint Eats app. It has been updated. You can now enter recipes, also reviews for food retailers, and the pantries, our local pantries. If you know of someone or maybe yourself are short on food any given month or week, there is a list of all the pantries in the map, and it shows you when they're in operation. You can use those resources and provide for your family and your loved ones. Next slide. Again, that's the Flint Eats app. We're so excited to share that Flint Innovative Solutions will be launching Tech Tuesdays with Google. This will gain digital skills needed for success. You can register at flintinnovativesolutions.org Tech Skills. Our next slide, please. Our next workshop will be February 28th. That's the fourth Tuesday of February from 4:30 to 6 o'clock. We'll be teaching on learning the basics of Google Drive. And we'll have a different topic every month. And our next huge announcement is that Google certifications are available in our partnership with Grow with Google. Grow with Google. There are 6 certifications. We also have scholarships available for you and or your family or loved one to go through that training. There's 6 projects, 6 programs or courses that you can take. It takes about 6 months for folks if they utilize 10 hours a week to go through that training. Project management, digital marketing and e-commerce, IT support, etc. Again, go to our website for more information. If you're interested in the scholarship and or if you need a loaner device, we do have a limited supply of those as well. Next slide. Again, those a little more information about the Google career certifications and where are at time. So we'll just breeze through to our next one. We're also at Hasselbrink Senior Center for our smartphone training with Ms. Beverly. And I will pause the next slide, please. As we always share this information, and as Mr. Spann shared, the Genesee Health System has provided this phenomenal CIT training for officers, law enforcement agents, and they are a resource to our community. If you know of anyone or you yourself need additional support, even grief support, they have resources available. You do not have to do this on your own. There are tons of support to help us walk through these challenging times. Next slide. So with that being said, we're right at time. Join us next month, which will be March 12th of the second Sunday at 3:30 for our phenomenal medical professionals, Dr. G, Nurse T, Nurse Battle. And again, Mr. Spann, we are so thankful for you taking time out of your afternoon to join us to share this tremendous resource to the community. Any last words you'd like to share, anyone? All right, y'all. See, it's so much. It just can't do one thing. Thank you, thank you, thank you. Kudos to everyone who have this information. Share it out. We'll put those announcements in our Facebook. Mr. Spann, thank you so much. Dr. Gordon, Nurse T, Nurse Battle. Continue blessings as you are out in the streets, taking it to the streets. COVID-19 information for us, by us. Have a blessed evening, everyone.
Oh, the wind down is the 16th. It's Thursday.
Awesome.
Mm-hmm.
Join Nurse T for the wind down on Thursday.